Good afternoon and welcome to another COVID-19 update. I am Stacey Carmichael and of course I'm joined by Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, good afternoon and welcome again.
Well, good afternoon to you and your viewers, and thank you once again for having me on this program.
You're welcome. Now, Minister Anthony, permit me to ask about the continued transmission of COVID-19. As it relates to the increase in cases, the number of cases, what's government's position in regards to community transmission?
Well, basically, we have been, the pattern of transmission that we had in Guyana was that of clusters. So we have seen clusters of cases happening in various regions, various communities. And we continue to see that. The epidemiologists are not firm as yet whether the epidemic has moved from one of cluster to where we have community transmission. What really it is when you talk about community transmission is that a lot of people are probably asymptomatic and can easily transmit the virus. I haven't seen anything as yet from the epidemiologists locally who have been monitoring the situation to suggest that we have transitioned from clusters to community spread. Nevertheless, we'll continue to monitor and see how this develops. Indeed, over the last couple of days, I think you would have seen a number of cases being recorded. But again, we have to examine where those cases are coming from. And for Region 4, while we would have had a steep increase, a lot of those cases are coming out of the Lusignan prison. We have done about 200 tests in Lusignan prison, and of those 200 tests, we had about 142 persons coming back positive. And those cases are registered in Region 4. So while if you're following the dashboard, you would certainly see a spike in Region 4 numbers, but that spike is because of what is happening at Lusignan prison. Since we have discovered that, our advice to the prison was to isolate these prisoners. They have started that process. They have done that in a lot of ways, put those who are positive and separate them out from the general population. That has been our medical advice to the prison authority, and we understand they're complying with that advice. We have also given to the prison services some medical personnel for this period so that the medical personnel can monitor the prisoners who have tested positive. And if any one of them start developing more moderate to severe symptoms, we have put a mechanism in place to move them from the isolation to be able to get hospital services, which they will need. So those mechanisms are in place, and we are confident that it will work.
Very much, Minister. Now, on the topic of isolation, home isolation, how is the surveillance aspect of that process going?
So basically, once you test positive, you have two options in terms of isolation. One option is that we can put you in an institutional facility, that is the government-run facility, and we have institutional isolation in every region of Guyana. So we have the capacity of keeping people in these institutions. We also allow people who have tested positive to isolate themselves at home. And they have to follow certain basic guidelines, because if you're at home, then you need to stay home. You need to be out of contact with the rest of the people in the home so that you don't infect others. And contact in terms of using bathroom and other things like that, you have to minimize those types of contact. So one of the things that we have tried to do is those persons who we are allowing to self-isolate, they must meet some basic requirements to stay at home. And while they self-isolate at home, it's a two-way process. One, we will have persons from the surveillance department who would be calling them on a regular basis to ensure that they're okay, that they didn't have any other signs or symptoms. And if they do, we have a checklist that the people would go through. And if they do, then we'll advise them on what measures to take. On the other hand, the persons who are in self-isolation would also have the hotline numbers. And if they feel, for whatever reason, that they're getting other signs and symptoms, let's say they're going into respiratory distress or something of the sort, they can call these hotline numbers or call the ambulance services. And once they call there, we would have one of the ambulances go out to pick up people and to bring them into the Georgetown Hospital. So it's a two-way process. One, we call to check up on you, but even if we don't call, because we have a lot of people to check up on, even if we don't call and you're experiencing a problem, then you can call us to ensure that we can help you, right? So it's that two-way process. We are having, however, a bit of a challenge sometimes, because persons who are on home isolation, sometimes they don't stay at home, and that can pose a danger to other persons, because if you have a positive person who know that they are positive and working around, they can infect others, right? And that's why we want to ensure that people abide by these rules. These things are serious. We make these rules not because we want to keep people at home and things like that. We make them because we want to protect people and to slow the spread of this disease. And if you're positive and we told you to isolate, we expect that you would do that. And you would stay at home, at least for the minimum 10 days. If you don't have any signs or symptoms, we will observe you for another 3. And once you have passed that 3 days without signs or symptoms, meaning now you're at 13 days, then you can be discharged. And when we discharge you, we also issue you with a discharge certificate, so that if you're working and so forth, you can return to work, you can present your certificate, so that people can know that you have gone through this process and you have been properly discharged. A good example of this is that, the Speaker of the National Assembly here, upon his discharge, he did receive his certificate of discharge from the doctors, and when he did receive that, then he decided to return back to the Parliament. I think we'll want everybody who has been in self-isolation to behave as the Speaker did, in receiving their discharge certificate and then return back to normal activity.
Thank you very much, Minister. Now, as it relates to returning Guyanese from Suriname, could you comment on the ministry's role as part of what was a multi-sectoral effort to get them back to local shores?
There were a number of Guyanese who were stranded in Suriname and they wanted to come back home. The challenge that many of them were having is that Suriname was not allowing a PCR test if you were asymptomatic or if you did not have exposure to coronavirus. And therefore they were stuck. They couldn't get the test and therefore they couldn't come home, because our laws require that anybody coming in must have a negative PCR test. Fortunately, when President Santoki met with President Ali, among the things that they discussed was how to repatriate the Guyanese who were stuck in Suriname. And the government of Suriname agreed that they would facilitate this by doing the tests for those Guyanese And all of this was arranged by our embassy in Suriname and the government of Suriname. And we then had to send the Sandaka to pick up people, and they came back home. And then, of course, once they came home, we had a medical team in Skeldon that was able to receive them, screen them, and then we put all of them under home isolation, home quarantine rather, because they came back with a negative PCR, and we're going to observe them for the next 7 days. And once nothing develops, they would be discharged from quarantine as well.
Thank you very much, Minister. Now, and before we close off, you always get a reminder to persons. Could we have that reminder before we go?
Well, again, we just want people to observe the 3 W's, and that is watch your distance, which means that you must stay at least 3 feet away from the other person. Wear a mask, because masks help to prevent infection. If somebody is infected and they're next to you and they cough or sneeze, the mask would contain that cough and sneeze or reduce the spread of droplets and aerosols. And if you wear a mask, it would prevent you from getting infected. The easiest way of how people get infected is because they inhale these droplets or aerosols. So if you have a mask, it is a physical barrier to prevent these things from getting into your system. So wearing a mask is important. And of course, because we're constantly touching various surfaces, we can contaminate our hands, and then we unwittingly would put our hands, touch our face, and so forth, and we can spread the infection like that. The surfaces that we touch, we are not sure what might be on those surfaces. And coronavirus, as far as we know, can survive on various surfaces for hours. So if somebody who was infected passed around, touch a door handle, sneeze next to a table, and then you come along maybe 10 minutes after, there's nobody in the room, but you touch the surface, you can easily infect yourself. So if people adhere to these 3 W's, watch your step, wear a mask, and wash your hands, I think we would be able to reduce a significant amount of the infections that are circulating. And once we reduce spread, we'll be able to control the infection better in Guyana.
Thank you very much, Minister, once again for being on another COVID Update program. And thank you very much, viewers and listeners. This has been COVID Update.